So when a patient is traveling from, let's say, UK or US, and they are traveling for full mouth rehabilitation,
Right.
so what is the realistic timeline that you give them, and how do you do your work of full mouth rehabilitation that you generally do in months time, and how do you complete it in 10 to 12 days of time?
When an international patient from whichever country gets in touch with us, the treatment plan is presented to the patient, all their questions are answered, the patient is convinced that they're coming to the right place for their dental treatment, and the whole itinerary is chalked out for them. When these patients come from thousands of miles away, putting their trust into us, we really need to adhere to the timeline because they have their incoming and outgoing flights booked. So we cannot really be playing around with their, travel plans.
Right.
So we help them with their stay. We help them with their internal travel. We help them with their tourism-related travel if the need be. Nowadays, most of the patients, they are. You get a lot of information on the internet, so most of the patients do their own planning. But if at all they require any kind of inputs from us, we are more than happy. We are more than glad to help them with these kind of plannings. When the patients come here, the entire timeline is planned out for them. A typical dental implant treatment is always done in 2 stages. The first stage is the surgical stage, in which the teeth are extracted, the implants are placed, and the temporary teeth are fixed. Normally, all these things are done over a duration of about 8 to 10 days. So the patient keeps those 8 to 10 days for us, and then they are flying out of the country. They come back for the second visit anytime after 6 to 7 months. Now, many patients have their commitments in their home countries. They may not come within 5 to 6 months. We have cases where we have placed the implants about a year back and the patient comes back after a year. It doesn't matter. The longer we wait in case of implants, the better is the healing between the bone and the dental implants. So when the patient comes back the second time for the second stage, that's when we actually do the scanning and the final teeth set is fabricated. Normally the second stage is done over a period of another 8 to 10 days. So the patient keeps those 8 to 10 days for us, and then they are flying back out of the country again, back to their home country with a nice, good, perfect set of teeth.
So as you said that the implant is done, dental full mouth rehabilitation is done in 10 to 12 days.
Right.
So what about the follow-up visit for the permanent fixture of the thing?
Right.
How early or late they should come to you again for the permanent setup?
Right. To answer your question, before the patient leaves their home country to come to us, the entire schedule is given to them that we are going to do so and so on so and so day. I need them to be here. After that, they get a break for a day or 2. Then we are going to do so and so things for them. So the patient comes with ready mind frame, as to what to expect on what day, what is going to be done for him or her. So that makes the whole procedure much more, easier for them. They know what they are getting into right before they leave their homes.